Hey guys, welcome to Mystery Diagnosis. As you can tell, I'm feeling a lot better and my depression is gone again. So yeah, I bounced back fast
I
from
was
my
actually sitting
depression.
on the couch folding laundry, and I just felt a strange headache. It really caught me off guard.
One
Tapatuma?
headache turns into two, then three, and over the course of the next month, they seem to take on a life of their own. Our set of symptoms: debilitating headaches, rapid heart
The question is,
palpitations,
where's
and
her
bouts of excessive
tumor?
sweat.
Once I figure out, I
There were
can
no
diagnose
answers.
it.
There were no cures. There were only symptoms.
Then, almost overnight, a disturbing new symptom threatens to send the entire family into a tailspin.
Anger.
I would have meanness.
All of a sudden, I had what probably the kids called Psycho Mom on my hand.
I love that analogy.
I'd run across a picture or something, and it's like, I'm not worth this. And I would tear it up. I don't think that man heard "I love you" for 2 years straight. My husband would always try to make sure that I didn't see my children.
Good.
And almost immediately realizes that Melinda's blood pressure and heart rate are elevated.
Certainly, high blood pressure can cause one to have headaches, but the reality is
Yeah, I'm
many
not convinced
patients
about
have
that
high
though.
blood pressure and they didn't have the personality changes
Right.
that she had. So we did a cardiogram to rule out that there was any cardiac disease or heart disease that might predispose her to her rapid heart rate.
But when the findings are in, Dr.
They're
Sussman
normal?
finds himself at a loss for words.
The cardiogram was normal. There was, no abnormalities.
He looked at me dead in my face, and he said, I don't know what it is, but if you hang in there with me, we'll find out.
Good for
The only
him.
thing he can do at this point is give Melinda a prescription to help control her high blood pressure and encourage her to check back in if anything changes. For the next 6 months, Melinda's symptoms go from debilitating to life-threatening.
If you're enjoying
I
this
gave
episode
up
of
saying
Mystery
it can't get no
Diagnosis,
worse because I realized it could. I went from 128 pounds, slowly dwindling away, to 92 pounds.
She would go out and buy new pants every so often, but you would tell that they're hanging off of her.
She was getting pale. She was thin. She was deathly thin.
At the age of 40, my mom looked like a woman that was near her 60s. Her hair was very thin. She had skin just hanging off of her bones. It was really frightening.
But 2 days before she's scheduled to go in, there's a frightening new development.
I went to scratch my stomach, and underneath my ribs, I felt this lump. It was a good-sized lump. I knew when I felt it, that wasn't where it was supposed to be, whatever it was. So I called Dr. Sussman.
Dr. Sussman examines the bizarre protruding lump located under Melinda's left ribs and finds a growth the size of a grapefruit. But when the findings come in, Dr. Sussman knows he's cracked the case.
I can't
Pheochromacytoma.
recall any other patient where I have seen levels as high as hers. So I knew that Melinda had a pheochromacytoma.
A pheochromacytoma is a tumor located on one of the adrenal glands, which sit on top of both kidneys. In healthy individuals, the adrenal glands produce adrenaline to help maintain blood pressure and cope with stressful situations. But in patients like Melinda, a tumor develops on one of the glands, causing an overproduction of adrenaline.
It is such a rare situation that many pheochromocytomas aren't diagnosed till autopsy.
Right.
But the surgical procedure to remove the growth is also very risky.
Mm-hmm.
The tumor has been successfully removed. Melinda is in stable condition.
When I woke up and I realized that headache was gone, it was like breathing fresh air for the first time. I was reborn.
This may surprise you, but the illness I find the most scary that you guys wouldn't know of is muscular dystrophy. I cannot imagine anything more scary than slowly watching yourself lose control of your muscles. Sure, you lose control of your ability to walk, which is scary, but compare that to the weight loss with cancer, which is scary. But with this muscular dystrophy, you're losing control of all your muscles, so you're losing control to breathe and all that. That's way scarier than cancer. As for the saddest condition, I put it as Huntington's disease.
Huntington's disease is an inherited genetic disorder that causes the progressive breakdown of nerve cells in the brain. It deteriorates a person's physical and mental abilities, usually during their prime working years. HD is ultimately fatal, and there is no cure. To talk, walk, and eat, requiring around-the-clock professional care. Symptoms include personality changes and mood swings, anxiety, depression and OCD, forgetfulness and impaired judgment, unsteady gait and involuntary movements known as chorea, slurred speech, and difficulty swallowing.
The reason Huntington's is so sad, it happens when you're in the middle ages, like 30, 40, 50s. You can also get pre-Huntington's, which is where you get it when you're in the kid to teenage years, like 10 to 16. Thank you very much for watching. I hope you liked, because this was a lot of fun to make. And I will see you in the next video. Bye.